We continue to follow the latest on the COVID-19 pandemic right here in mid-Missouri. Local healthcare organizations are making changes to keep up with this outbreak. We're joined now by Dr. Mark Wakefield, who's an Associate Chief Medical Officer at MU Healthcare. And Mark, thank you so much for joining us this morning.
Good morning. Thank you.
Good morning. I know it's a very busy time, so we really appreciate your time, but we'll just go ahead and jump right into these questions. So how has MU Healthcare adapted its clinics to fight this outbreak during this time?
So one thing that we've done that's dramatically different is we've adopted telehealth visits, which can either be from video or telephone. Prior to COVID-19, we were averaging about 150 to 200 visits out of 20,000 per month. And last week we did close to 2,000 video visits.
Wow.
So this is an amazing change, which I think will last long after the COVID-19 crisis. It's convenient for patients, and if you don't need to examine them, touch them, or do a procedure, the patient saves a lot of time and hassle, and we can refill medications and check in on how they're doing. It was really a rapid change, but I think it's for the better in the long term.
Absolutely, and it's kind of like what we're doing right now, except, you know, I'd be coming to you with maybe a medical issue instead of just a lot of questions for you.
Or the way we're holding this interview.
Yeah, absolutely. And you know, we keep hearing the term flatten the curve. Can you kind of explain to us and our viewers what that means?
That's a great concept and why social distancing and hand washing is so important. Flattening the curve prevents the peak surge of critically ill patients saturating the hospital and overwhelming resources. So if, it does prolong the duration of illness in some models, but it prevents people from being unable to access care, for example, in the intensive care unit or in the emergency department, because those places become oversaturated. So flattening the curve is a very important model and relies on social distancing and hand washing to protect patients and healthcare workers.
Yeah, and we've gotten a lot of questions here at the station about viewers just asking, how can I help? What does the hospital need? Are people able to make those masks for those healthcare providers for you?
So it's overwhelming the number of people that have reached out to try to help, and the positive reinforcement to healthcare workers and the dedication and devotion. MU Healthcare has a website with instructions on how to make contact and supply resources. We have to be careful with homemade masks just to make sure that they're effective and clean, and so there's a method for helping with that.
Absolutely. Well, Dr. Wakefield, thank you so much for your time, and give our gratitude to all the healthcare workers on the front lines during this time.
Well, appreciate that. Thank you.
We'll check back in with you in just about 20 minutes. And now, taking a look at the outbreak's impact around the world, the U.S. has passed a tragic milestone as more than 3,000 people have now died from COVID-19. Those new numbers were just released a few hours ago.
Kind of active weather pattern where we're tracking just about daily rain chances there on the back half of that 7-day forecast. So stick with us. Again, we'll continue to track the timing on that. Nothing looks strong to severe at this point, but we could hear a few rumbles of thunder as we head into this weekend, Zara.
All right, Kevin, thanks for tracking it.
No problem.
And as we continue to follow the latest on the COVID-19 pandemic in mid-Missouri, local healthcare organizations are making changes to keep up with the outbreak. We're joined live now by Dr. Mark Wakefield, who's an Associate Chief Medical Officer at MU Healthcare. Doctor, thank you so much for taking the time to join us this morning.
You're welcome. Good morning.
Good morning. And so we've heard a lot about drive-through testing. How is MU Healthcare keeping up with that drive-through testing demand?
Well, we've been doing about 200 tests a day through our drive-through, and it's been well staffed. That's a group of nurses and other support staff that have really come together and demonstrated a team approach. I just was listening to the weather forecast, and they've had some bad weather in the last week that they've persevered through. And it's providing a great service, keeping patients away from the emergency department who are not sick, and it's a good utilization of our testing resources.
Absolutely. And now switching gears, talking about more recovery efforts. We know 23 people so far have recovered from this virus just here in Boone County. How have those recovery efforts been for MU Healthcare?
Well, we're averaging about 2 or 3 patients in the hospital at a time, and they're discharging home and then recovering. And so I think this is room for optimism with a disease that is pretty scary and has affected many people. It's hard to imagine anyone not touched by COVID-19 at this point, but most people will be sick for a couple weeks and then recover, and eventually we'll have a new normal in a few months.
Absolutely. And I know there, like you said, about 2 to 3 patients actually in the hospital at a time, but you are prepared for an influx if that were to happen.
That's correct. We have contingency plans for surges of patients that need critical and inpatient medical care. We have to do that thoughtfully and protective of the patients and providing the best possible care while conserving resources today for potential use tomorrow. It's a critical part of our mission, and we're ready to serve in that role.
And so how are some other ways MU Healthcare is changing its operations at this time?
Well, right now we're having a very limited visitor policy, essentially no visitors in the clinics or the hospital. And this is can be very disruptive and disturbing for family, but it's a very important step to limit the spread of the virus, especially among vulnerable patients and healthcare providers.
Yeah, Dr. Wakefield, we truly appreciate your time with us this morning. We know it's very busy. And of course, please tell your staff thank you for being on the front lines of this virus. We are sincerely grateful.
It's our pleasure to serve. Thank you.